Question 1. Cost-benefit analysis shows that implementing interventions based on Vygotsky's sociocultural theory can be highly effective for children experiencing developmental delays, particularly in fostering social cognitive skills. Considering a scenario where a psychologist is working with a young child who struggles with peer interaction and collaborative learning, which of the following approaches best aligns with Vygotsky's principles for optimizing the child's learning and development within their zone of proximal development? Option A. Encouraging the child to observe and imitate more socially adept peers during unstructured playtime without direct intervention from the psychologist. Option B. Recommending that the child attend a specialized program focused on intensive, individualized skill-building exercises to address specific deficits in isolation. Option C. Focusing solely on direct, one-on-one cognitive remediation sessions with the child to strengthen foundational skills before introducing social elements. Option D. Designing structured play activities where the psychologist acts as a facilitator, guiding the child and peers through collaborative tasks, providing prompts and modeling effective communication and problem-solving strategies. The correct answer is D. Designing structured play activities where the psychologist acts as a facilitator, guiding the child and peers through collaborative tasks, providing prompts and modeling effective communication and problem-solving strategies. Explanation. This scenario presents a professional challenge because it requires a psychologist to balance the immediate need for intervention with the long-term developmental implications for a child, all within the ethical and legal boundaries of practice. The psychologist must consider how to best support the child's learning and social integration, recognizing that effective intervention is not solely about direct instruction, but also about fostering the child's capacity to learn through social interaction. The American Board of Professional Psychology, APA standards, emphasize evidence-based practice and the ethical imperative to act in the best interest of the client, which in this case includes the child's developmental trajectory. The correct approach represents best professional practice because it directly applies Vygotsky's sociocultural theory by focusing on the zone of proximal development, ZPD. By scaffolding the child's learning through guided participation with peers and the psychologist, the intervention aims to move the child towards independent functioning. This aligns with the APA commitment to promoting psychological well-being and development through scientifically sound and ethically grounded interventions. The emphasis on social interaction as a primary mechanism for learning is a core tenet of Vygotsky's theory and is crucial for addressing the child's specific challenges. An incorrect approach that focuses solely on direct, individualized remediation without incorporating social interaction fails to leverage the power of collaborative learning as described by Vygotsky. This could lead to a less efficient or less sustainable improvement, as the child may not develop the skills to generalize learning to social contexts. Ethically, this might be considered a failure to provide the most effective intervention available, potentially violating the principle of beneficence. Another incorrect approach that relies exclusively on peer modeling without structured guidance from the psychologist overlooks the role of the more knowledgeable other, MKO, in facilitating learning within the ZPD. While peer interaction is valuable, the psychologist's expertise is needed to identify the appropriate level of support and to ensure that the interactions are productive for the child's development. This could result in the child not being adequately challenged or supported, leading to stalled progress. This approach could be seen as a failure to adequately assess and intervene within the child's ZPD. A further incorrect approach that prioritizes isolating the child for intensive individual therapy to address deficits, without considering the social context of learning, fundamentally misunderstands Vygotsky's theory. This approach neglects the crucial role of social interaction in cognitive development and may inadvertently hinder the child's ability to learn and function within their social environment. This would be a significant ethical lapse, as it fails to utilize a theoretically informed and developmentally appropriate intervention strategy. The professional decision-making process for similar situations should involve a thorough assessment of the child's current abilities and their ZPD. This assessment should then inform the selection of interventions that are theoretically grounded, evidence-based, and tailored to the child's specific needs and developmental stage. Professionals must continuously evaluate the effectiveness of interventions and be prepared to adjust their approach based on the child's progress and evolving needs, always prioritizing the child's best interests and adhering to ethical guidelines. Question 2. The control framework reveals a psychologist has received information from a client indicating a clear and serious intent to harm a specific identifiable third party. The psychologist has assessed the threat as credible and imminent. What is the most ethically sound course of action according to the APA ethical guidelines? Option A. Attempt to persuade the client to voluntarily seek help or refrain from harming the third party, without any disclosure, as this preserves the therapeutic alliance. Option B. Maintain strict confidentiality, as the client's privacy is paramount and the APA ethical guidelines do not permit exceptions for potential harm. Option C. Document the client's statement but take no further action, as the psychologist's role is limited to therapeutic intervention and not to act as a predictor of future behavior. Option D. Immediately disclose the information to the potential victim and or appropriate authorities, after making reasonable efforts to inform the client of the disclosure. The correct answer is D. Immediately disclose the information to the potential victim and or appropriate authorities, after making reasonable efforts to inform the client of the disclosure. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a psychologist's duty to protect a client's confidentiality and the potential risk of harm to a third party. The psychologist must navigate the complex ethical landscape of balancing these competing obligations, which requires careful judgment and a thorough understanding of relevant ethical principles and legal mandates. The APA ethical guidelines provide a framework for such difficult decisions, emphasizing the importance of considering the severity of the threat, the imminence of harm, and the availability of less intrusive alternatives. Correct approach analysis. The correct approach involves a multifaceted assessment and action plan that prioritizes the safety of the potential victim while minimizing breaches of confidentiality. This aligns with APA Ethical Standard 4.05 disclosures, which permits disclosure when necessary to prevent serious, foreseeable, and imminent harm to a person or persons. It also aligns with Standard 1.02, conflicts between ethics and law, regulations, or other governing legal authority, which guides psychologists to make known their commitment to the ethics code and to take steps to resolve the conflict in a manner consistent with fundamental principles of human rights. The psychologist must first attempt to mitigate the risk by working with the client to ensure their safety and the safety of others. If this is not possible, and the threat is credible and imminent, then disclosure to appropriate authorities or the potential victim is ethically mandated. This approach demonstrates a commitment to beneficence and non-maleficence, as well as fidelity and responsibility. Incorrect approaches analysis. One incorrect approach would be to strictly adhere to confidentiality without any attempt to assess or mitigate the risk, even when faced with a credible threat of serious harm. This fails to uphold the principle of non-maleficence, as it could lead to foreseeable harm to a third party. It also disregards the exceptions to confidentiality outlined in the APA Ethics Code. Another incorrect approach would be to immediately disclose the information to authorities or the potential victim without first attempting to work with the client to address the threat or exploring less intrusive interventions. This constitutes an unnecessary breach of confidentiality and may damage the therapeutic relationship, potentially hindering the client's progress and well-being. It fails to demonstrate fidelity and responsibility by not exploring all avenues to resolve the conflict ethically. A third incorrect approach would be to ignore the information or dismiss the client's statements as non-credible without a thorough and objective assessment of the threat. This abdication of professional responsibility could have severe consequences if the threat is real, violating the principle of non-maleficence and potentially leading to harm. Professional reasoning. Professionals facing such dilemmas should engage in a systematic decision-making process. This involves 1. Identifying the ethical issue and relevant APA ethical principles and standards. 2. Assessing the nature and severity of the potential harm, including the imminence and credibility of the threat. 3. Considering the client's rights and the potential impact of disclosure on the therapeutic relationship. 4. Exploring all possible interventions to mitigate the risk, starting with the least intrusive. 5. Consulting with supervisors or colleagues when necessary. 6. Documenting the decision-making process and the rationale for the chosen course of action. 7. Acting in accordance with legal requirements and ethical mandates. Question 3. The performance metrics show a consistent pattern of high client satisfaction scores for Dr. Anya Sharma. Recently, A former client whose therapy concluded over 2 years ago has invited Dr. Sharma to attend their sibling's wedding. The former client's sibling is a professional colleague of Dr. Sharma's spouse, and Dr. Sharma has met this sibling briefly at a professional networking event. Dr. Sharma feels a genuine warmth towards her former client and believes this social engagement could be a positive experience. However, she's aware of the ethical considerations surrounding multiple relationships. What is the most ethically sound course of action for Dr. Sharma? Option A. Accept the invitation but refrain from discussing any aspect of her former client's therapy during the event. Option B. Politely decline the invitation, citing professional boundaries, and offer to send a congratulatory card. Option C. Discuss the situation with a trusted colleague or supervisor to explore potential ethical implications and seek guidance before making a decision. Option D. Accept the invitation, reasoning that the therapy concluded long ago and the relationship with the sibling is tangential. The correct answer is B. Politely decline the invitation, citing professional boundaries, and offer to send a congratulatory card. Explanation. This scenario presents a professional challenge due to the inherent conflict between the psychologist's professional role and their personal relationship with a former client's family member. The American Psychological Association's APA, Ethical Principles of Psychologists and Code of Conduct, specifically Standard 305 Multiple Relationships, prohibits psychologists from entering into such relationships if they are likely to impair the psychologist's objectivity, competence, or effectiveness in their professional role, or if they risk exploitation or harm to the other party. The passage of time since the termination of therapy does not automatically negate the potential for harm or exploitation, especially when the relationship involves a close family member of a former client. The correct approach involves a careful assessment of the potential risks and benefits, prioritizing the welfare of the former client and the integrity of the professional relationship. This includes considering whether the new relationship could inadvertently lead to the disclosure of confidential information, create a perception of bias, or compromise the psychologist's ability to provide objective professional services if future professional contact were to arise. Consulting with a supervisor or ethics committee is a crucial step in navigating such complex situations, ensuring adherence to ethical guidelines and best practices. An incorrect approach would be to immediately agree to the social invitation without a thorough ethical review. This fails to acknowledge the potential for harm and the ethical obligation to avoid situations that could impair professional judgment or exploit the relationship. Another incorrect approach would be to assume that because the therapy has been terminated, the dual relationship poses no risk. This overlooks the enduring nature of the therapeutic relationship and the potential for residual influence or the perception of impropriety. Finally, an incorrect approach would be to prioritize personal desires over ethical obligations, thereby risking harm to the former client and compromising the profession's integrity. Professionals should employ a decision-making framework that begins with identifying potential ethical conflicts. This involves recognizing the existence of a multiple relationship and assessing its nature and potential consequences. Consultation with peers, supervisors, or ethics committees is paramount. Documentation of the decision-making process and the rationale for the chosen course of action is also essential for accountability and professional development. The ultimate goal is to protect the welfare of clients and maintain the public's trust in the profession. Question 4. The evaluation methodology shows a psychologist is conducting a comprehensive assessment for a client referred for evaluation of potential learning disabilities. The psychologist has selected a broad range of cognitive, academic, and behavioral measures. However, the specific referral question is focused on identifying specific academic deficits that may be impacting the client's performance in a particular subject area. Which of the following approaches best aligns with the purpose of this assessment? Option A. Prioritizing the administration of projective personality tests to understand the client's underlying emotional state, as this may be contributing to academic difficulties. Option B. Relying solely on the client's self-report of academic struggles without administering any formal psychometric assessments. Option C. Administering a broad battery of cognitive and academic tests to cover all potential areas of difficulty, regardless of their direct relevance to the specific referral question. Option D. Selecting a targeted set of assessments that directly address the suspected learning deficits related to the specific subject area, supplemented by a brief screening of broader cognitive abilities if indicated by initial findings. The correct answer is C. Administering a broad battery of cognitive and academic tests to cover all potential areas of difficulty, regardless of their direct relevance to the specific referral question. Explanation. This scenario presents a common challenge in psychological assessment, where the purpose of the evaluation is multifaceted and potentially conflicting. The psychologist must navigate the ethical imperative to conduct a thorough and appropriate assessment, while also ensuring that the chosen methodology aligns with the stated goals and is understood by all relevant parties. The professional challenge lies in selecting an assessment approach that is both scientifically sound and ethically defensible, particularly when the information gathered may have significant implications for the individual being assessed. The correct approach represents best professional practice because it prioritizes a clear understanding of the assessment's purpose and selects instruments that are validated for that specific purpose. This aligns with ethical guidelines that mandate competence, informed consent, and the use of appropriate assessment tools. By tailoring the assessment to the stated goals, the psychologist ensures that the evaluation is relevant, efficient, and minimizes the risk of misinterpretation or misuse of findings. This also supports the principle of beneficence and non-maleficence by ensuring the assessment serves the client's best interests and avoids unnecessary or harmful procedures. An incorrect approach that relies solely on a broad battery of tests without a clear rationale for each would be ethically problematic. This could lead to an inefficient and potentially overwhelming assessment, increasing the risk of client distress and the generation of irrelevant data. It may also violate the principle of using only those tests for which the psychologist is qualified and that are appropriate for the specific purpose. Another incorrect approach, focusing only on the client's self-report without incorporating objective measures, would fail to provide a comprehensive picture and could lead to biased conclusions, especially if the client's perception is distorted or incomplete. This neglects the ethical responsibility to conduct a thorough and objective evaluation. Professionals should employ a decision-making framework that begins with a clear articulation of the assessment's purpose, considering the referral question and the context. This should be followed by a systematic review of potential assessment methods and instruments, evaluating their validity, reliability, and appropriateness for the specific purpose and population. Informed consent should be obtained, ensuring the client understands the purpose, procedures, and potential outcomes of the assessment. Finally, the psychologist must integrate findings from multiple sources, interpret them within the context of the assessment's purpose, and communicate them clearly and ethically. Question 5. The monitoring system demonstrates a consistent pattern of scoring for clients with similar presenting problems, but there is emerging concern that the scores may not accurately reflect the underlying psychological constructs they are intended to measure. A psychologist is reviewing the system's utility for ongoing client progress monitoring. Which of the following represents the most ethically and professionally sound approach to addressing this concern? Option A. The psychologist should rely on their clinical judgment alone to interpret the scores, as personal experience is the most important factor in assessing client progress. Option B. The psychologist should immediately discontinue the use of the monitoring system and seek a completely new, unvalidated system that might offer a fresh perspective. Option C. The psychologist should investigate the empirical evidence for the construct validity of the monitoring system, considering whether the instrument has been validated for the specific client population and the intended purpose of progress monitoring. Option D. The psychologist should continue using the monitoring system as it has demonstrated reliability, assuming that consistent scores will eventually lead to accurate progress assessment. The correct answer is C. The psychologist should investigate the empirical evidence for the construct validity of the monitoring system, considering whether the instrument has been validated for the specific client population and the intended purpose of progress monitoring. Explanation. The scenario presents a common challenge in psychological practice, ensuring that the tools used to assess clients are both reliable and valid. A monitoring system in this context likely refers to a standardized assessment instrument or a system for tracking client progress. The professional challenge lies in the psychologist's ethical and legal obligation to use instruments that accurately and consistently measure what they are intended to measure, and to do so in a way that is appropriate for the client and the clinical context. Failure to do so can lead to misdiagnosis, inappropriate treatment planning, and ultimately harm to the client. Correct approach emphasizes the psychologist's responsibility to critically evaluate the psychometric properties of any assessment tool before and during its use. This involves understanding the concepts of reliability, consistency of measurement, and validity accuracy of measurement, and applying this knowledge to select and interpret assessment data. For the American Board of Professional Psychology, this aligns with the ethical principles of competence and responsible assessment, as outlined in the APA Ethics Code, which is foundational for professional psychology practice in the U.S. Specifically, Standard 9.02 testing mandates that psychologists use assessment instruments that are valid and reliable for the intended purpose and population. The correct approach demonstrates adherence to these principles by seeking evidence of reliability and validity, and considering the appropriateness of the instrument for the specific client population and purpose of assessment. An incorrect approach would be to assume an instrument is adequate without empirical support, or to use it in a manner that disregards its established psychometric properties. For instance, relying solely on face validity, whether an instrument appears to measure what it should, without considering empirical evidence of construct validity, would be a failure. Similarly, using an instrument developed for one population with a vastly different one without evidence of its applicability to the new population is a significant ethical and regulatory failure, violating principles of appropriate use and potential for harm. Another incorrect approach would be to ignore evidence of poor reliability, meaning the instrument yields inconsistent results, which would undermine the accuracy of any conclusions drawn from its use. Such failures represent a breach of the psychologist's duty to provide competent and evidence-based services, potentially leading to misinformed clinical decisions and violating the principle of beneficence and non-maleficence. Professional decision-making in such situations requires a systematic process. First, identifying the purpose of the assessment. Second, researching available instruments and their psychometric properties, reliability and validity data, normative samples. Third, selecting the most appropriate instrument based on the client's characteristics and the assessment goals. Fourth, administering and scoring the instrument according to standardized procedures. And fifth, interpreting the results cautiously, considering the limitations of the instrument and the individual client. This iterative process ensures that assessment practices are grounded in scientific evidence and ethical considerations. Question 6. Market research demonstrates that clients experiencing suicidal ideation often benefit from a structured and collaborative approach to safety planning. A psychologist is working with a client who has expressed recent suicidal thoughts and has a vague plan. The psychologist has assessed the immediate risk as moderate but not imminent. Which of the following approaches best aligns with ethical and professional guidelines for safety planning in this context? Option A. Immediately recommend inpatient hospitalization to ensure the client's safety, given the presence of suicidal thoughts and a plan. Option B. Accept the client's verbal assurances that they will not act on their suicidal thoughts and conclude the session without further safety planning interventions. Option C. Contact the client's parents to inform them of the situation and request their assistance in monitoring the client, without first obtaining the client's consent. Option D. Collaboratively develop a detailed safety plan with the client, identifying specific coping strategies, warning signs, and a list of supportive contacts, while also discussing potential next steps if the plan proves insufficient. Correct answer is D. Collaboratively develop a detailed safety plan with the client, identifying specific coping strategies, warning signs, and a list of supportive contacts, while also discussing potential next steps if the plan proves insufficient. Explanation. This scenario presents a professional challenge due to the inherent complexity and potential volatility of safety planning, with individuals experiencing suicidal ideation. The psychologist must balance the immediate need for safety with the client's autonomy and the ethical imperative to provide effective, evidence-based care. Careful judgment is required to assess risk accurately, involve appropriate collateral contacts without breaching confidentiality unnecessarily, and develop a plan that is both protective and empowering for the client. The correct approach represents best professional practice because it prioritizes a collaborative and comprehensive safety planning process. This involves a thorough risk assessment, direct discussion of suicidal intent and plan with the client, and the development of concrete coping strategies and support systems. It aligns with ethical guidelines that mandate psychologists to take reasonable steps to prevent self-harm when clients present with such risks. Furthermore, it respects client autonomy by involving them actively in the planning process, fostering a sense of agency and increasing adherence to the plan. This approach is supported by the American Psychological Association's ethical principles of psychologists and code of conduct, particularly concerning risk assessment and intervention for potential harm. An incorrect approach that focuses solely on immediate hospitalization without exploring less restrictive interventions fails to adequately consider the client's right to self-determination and may lead to unnecessary stigma or distress. It bypasses the opportunity to empower the client with coping skills and support networks, which are crucial for long-term safety. This approach could be seen as a failure to explore all reasonable alternatives and could violate ethical principles related to beneficence and non-maleficence by imposing a potentially overly restrictive intervention without sufficient justification. Another incorrect approach that involves contacting family members without the client's explicit consent, unless there is an immediate and imminent threat that cannot be managed otherwise, represents a significant breach of confidentiality. Confidentiality is a cornerstone of the therapeutic relationship and is protected by ethical codes and legal statutes. While there are exceptions for imminent danger, these must be carefully evaluated and documented. Failing to obtain consent or to meet the stringent criteria for breaching confidentiality can lead to legal repercussions and damage the therapeutic alliance. A further incorrect approach that relies solely on the client's verbal assurances of safety without developing a concrete plan or exploring coping mechanisms neglects the dynamic nature of suicidal ideation. Verbal assurances can be transient, and without a structured plan, the client may be left without resources when distress escalates. This approach fails to meet the ethical obligation to actively intervene and develop a proactive safety strategy, potentially leading to a negative outcome. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough and ongoing risk assessment, including the presence of suicidal ideation, intent, plan, and access to means. 2. Engage the client collaboratively in developing a safety plan, discussing their triggers, coping strategies, and support systems. 3. Document all assessments, interventions, and discussions thoroughly. 4. Consult with supervisors or colleagues when facing complex cases or uncertainty. 5. Consider the least restrictive yet effective interventions, balancing client autonomy with the duty to protect. 6. Be aware of and adhere to all relevant legal and ethical mandates regarding duty to warn and protect. Question 7. Assessment of a psychologist's ethical and legal obligations when a client reveals intent to harm a specific, identifiable third party, considering the paramount importance of client confidentiality versus the potential duty to protect. Option A. Maintain strict client confidentiality and take no action, as the duty to protect does not override the absolute right to confidentiality in all circumstances, regardless of the perceived risk. Option B. Conduct a thorough risk assessment to determine the imminence and severity of the threat, consult with a supervisor or legal counsel, and take appropriate steps to protect the third party if a clear and present danger is identified, while also considering ways to maintain as much client confidentiality as ethically and legally permissible. Option C. Immediately breach client confidentiality and report the client's intent to the potential victim and law enforcement without further assessment or consultation, prioritizing the safety of the third party above all other ethical considerations. Option D. Document the client's statement of intent but take no further action, relying on the client's therapeutic progress to mitigate any potential risk without external intervention or consultation. The correct answer is B. Conduct a thorough risk assessment to determine the imminence and severity of the threat, consult with a supervisor or legal counsel, and take appropriate steps to protect the third party if a clear and present danger is identified, while also considering ways to maintain as much client confidentiality as ethically and legally permissible. Explanation. This scenario presents a significant ethical challenge due to the inherent conflict between a psychologist's duty to protect a client's confidentiality and the potential duty to warn or protect a third party when there is a foreseeable risk of harm. The psychologist must navigate complex ethical principles and legal mandates, which can vary in their specificity and application. The challenge lies in balancing these competing obligations while ensuring the client's well-being and safety, as well as the safety of others. Careful judgment is required to accurately assess the level of risk, determine the appropriate course of action, and document the decision-making process thoroughly. The correct approach represents best professional practice because it prioritizes a systematic, informed, and ethically grounded decision-making process. This involves a thorough risk assessment, consultation with supervisors or peers, consideration of relevant legal and ethical standards, such as those outlined by the American Psychological Association's Ethics Code, and relevant state laws regarding duty to warn/protect, and careful documentation. This approach ensures that the psychologist acts responsibly, ethically, and in accordance with professional obligations, minimizing potential harm to all parties involved. An incorrect approach that involves immediately breaking confidentiality without a thorough assessment fails to uphold the principle of beneficence and non-maleficence towards the client, as well as the fundamental ethical standard of confidentiality. It bypasses the necessary steps to determine if a genuine and imminent threat exists, potentially causing undue harm to the client's therapeutic relationship and trust. Another incorrect approach, which is to do nothing due to fear of legal repercussions or discomfort, violates the duty to protect when a foreseeable risk of harm is present, potentially leading to serious harm to a third party and significant legal and ethical consequences for the psychologist. Failing to consult with supervisors or colleagues when faced with such a dilemma represents a failure to adhere to best practices for professional development and ethical decision-making, increasing the likelihood of an inappropriate or harmful outcome. Professionals should employ a structured decision-making framework when faced with such dilemmas. This framework typically includes 1. Identifying the ethical issue and relevant principles. 2. Gathering all relevant information, including the client's statements, history, and any other pertinent data. 3. Assessing the level of risk to the potential victim. 4. Consulting with supervisors, colleagues, or legal counsel. 5. Exploring potential courses of action and their ethical and legal implications. 6. Making a decision and implementing it. 7. Documenting the entire process, including the rationale for the decision. Question 8. Comparative studies suggest that the accuracy of differential diagnosis in complex clinical presentations can be significantly influenced by the initial assessment strategies employed. Considering a client presenting with a constellation of symptoms that could plausibly indicate either a primary mood disorder or a complex trauma-related condition, which of the following evaluation approaches best aligns with best professional practice for establishing an accurate differential diagnosis? Option A. Utilizing a single, highly specific diagnostic instrument that is known to be effective for one of the suspected conditions, and basing the diagnosis solely on the results of that instrument. Option B. Relying primarily on the client's most prominent symptom at the time of the initial session to guide the diagnostic formulation, assuming this symptom is the most indicative of the underlying pathology. Option C. Conducting a comprehensive diagnostic interview that explores the onset, duration, and severity of all reported symptoms, alongside a review of any available collateral information, and administering a battery of empirically supported assessment measures relevant to both mood disorders and trauma-related conditions. Option D. Immediately focusing diagnostic inquiry on the most commonly diagnosed condition within the client's demographic, without extensive exploration of alternative explanations. The correct answer is C. Conducting a comprehensive diagnostic interview that explores the onset, duration, and severity of all reported symptoms, alongside a review of any available collateral information, and administering a battery of empirically supported assessment measures relevant to both mood disorders and trauma-related conditions. Explanation. This scenario is professionally challenging due to the inherent complexity of differential diagnosis, particularly when symptoms overlap across multiple potential conditions. The psychologist must navigate the ethical imperative to provide accurate and effective treatment while adhering to the American Board of Professional Psychology (APP) standards, which emphasize evidence-based practice and client welfare. The pressure to arrive at a definitive diagnosis can be significant, but rushing this process or relying on insufficient data can lead to misdiagnosis, inappropriate treatment, and potential harm to the client. Correct approach represents best professional practice because it prioritizes a thorough, multifaceted evaluation process. This aligns with APP commitment to competence and ethical conduct, which mandates that psychologists base their diagnoses and treatment plans on sound scientific evidence and clinical judgment. A comprehensive assessment, incorporating multiple data sources, e.g., clinical interviews, standardized assessments, collateral information, allows for more nuanced understanding of the client's presentation, increasing the likelihood of an accurate differential diagnosis. This systematic approach minimizes the risk of premature closure and ensures that the diagnosis is well supported, leading to more effective and ethical treatment planning. An incorrect approach that relies solely on initial symptom presentation without further investigation fails to meet the standard of care. This could be considered a violation of ethical principles related to competence and due diligence, as it bypasses the necessary steps for a robust differential diagnosis. Another incorrect approach that prematurely settles on a diagnosis based on a single, albeit compelling, piece of evidence overlooks the possibility of alternative explanations and the need for corroboration. This demonstrates a lack of thoroughness and could lead to a misdiagnosis, which is ethically problematic as it compromises the client's right to appropriate care. A further incorrect approach that prioritizes expediency over accuracy, perhaps due to time constraints or pressure, directly contravenes the ethical obligation to provide services that are in the client's best interest. This haste can lead to overlooking critical information, resulting in a flawed diagnostic process. Professionals should employ a systematic decision-making framework that begins with a broad consideration of potential diagnoses based on initial presentation. This is followed by a targeted information-gathering phase, utilizing appropriate assessment tools and techniques to differentiate between plausible conditions. Crucially, this process involves ongoing reevaluation as new information emerges. Professionals must remain open to revising their hypotheses and avoid confirmation bias, always prioritizing the client's well-being and the accuracy of the diagnostic formulation. Adherence to established ethical codes and best practice guidelines, such as those implicitly or explicitly endorsed by the app, is paramount throughout this process. Question 9. The performance metrics show a psychologist has been consistently liking and occasionally commenting on the social media posts of their current clients, often on topics unrelated to therapy. Which of the following actions best upholds professional ethical standards and protects client welfare? Option A. Terminate the therapeutic relationship with all clients involved in the social media interactions without further discussion. Option B. Ignore the performance metrics and continue the current pattern of social media interaction. Option C. Continue the social media interactions but ensure comments remain strictly professional and non-intrusive. Option D. Immediately cease all social media interaction with current clients and inform them of this boundary. The correct answer is D. Immediately cease all social media interaction with current clients and inform them of this boundary. Explanation. The performance metrics show a consistent pattern of a psychologist engaging in social media interactions with current clients, including liking their posts and occasionally commenting on non-therapeutic topics. This scenario is professionally challenging because it blurs the lines between the therapeutic relationship and personal acquaintance, potentially compromising the objectivity and efficacy of treatment. Psychologists are bound by ethical principles and regulatory guidelines that mandate the maintenance of clear professional boundaries to protect client welfare and the integrity of the profession. The correct approach, which involves ceasing all social media interaction with current clients and clearly communicating this boundary to them, represents best professional practice. This aligns with the American Psychological Association's APA, Ethical Principles of Psychologists and Code of Conduct, specifically Principle C, Integrity, which states psychologists should promote accuracy, honesty, and truthfulness in the science, teaching, and practice of psychology. It also directly addresses Standard 3.0.5 multiple relationships, which advises against engaging in professional activities when personal, financial, or other interests or relationships could impair objectivity or exploit the client. By disengaging from social media interactions, the psychologist upholds the professional nature of the relationship, prevents potential exploitation or harm, and ensures that the therapeutic space remains free from undue personal influence. An incorrect approach would be to continue the social media interactions, but attempt to keep them strictly professional and non-intrusive. This is ethically problematic because even seemingly innocuous interactions can create a dual relationship, potentially leading to a loss of objectivity, transference issues, and a compromised therapeutic alliance. The inherent nature of social media platforms encourages informal interaction, and maintaining a strictly professional stance within that context is exceedingly difficult and often perceived by clients as a blurring of boundaries. This approach fails to adequately protect the client from potential harm and violates the spirit, if not the letter, of ethical guidelines concerning multiple relationships. Another incorrect approach would be to ignore the performance metrics and continue the current pattern of interaction without any modification. This demonstrates a disregard for professional standards and ethical obligations. It suggests a lack of awareness or a willful neglect of the potential harm caused by boundary violations. This approach directly contravenes the ethical imperative to act in the best interests of the client and to avoid exploiting them, as outlined in Principle A, Beneficence and Non-Maleficence in Standard 3.05. A final incorrect approach would be to terminate the therapeutic relationship solely based on the social media interactions, without attempting to address the boundary issue first. While boundary violations can sometimes necessitate termination, the initial and most ethical step is to address the behavior directly with the client and attempt to re-establish appropriate boundaries. Unilateral termination without clear justification and communication can be perceived as abandonment and may cause further distress to the client, failing to uphold the psychologist's responsibility to minimize harm. Professionals should employ a decision-making process that prioritizes client welfare and adherence to ethical codes. This involves regular self-monitoring of professional conduct, seeking supervision or consultation when boundary issues arise, and proactively establishing clear boundaries at the outset of the therapeutic relationship. When performance metrics or client feedback indicate potential boundary issues, the immediate and ethical response is to address the situation directly, consult ethical guidelines, and make necessary adjustments to professional conduct to ensure the integrity of the therapeutic relationship. Question 10. To address the challenge of providing accurate and ethically sound psychological evaluations, a psychologist is asked to administer a complex neuropsychological assessment battery to a client with a suspected traumatic brain injury. The psychologist has extensive experience with general personality and cognitive assessments, but has limited direct experience with the specific neuropsychological tests required for this battery. Which of the following represents the most ethically and professionally sound course of action? Option A. Administer the tests, but interpret the results solely based on the automated scoring software, as this ensures objectivity and reduces the risk of personal bias. Option B. Proceed with administering the neuropsychological tests, relying on the test manuals and online resources to guide the process, as the core principles of psychological testing are universal. Option C. Decline to administer the specific neuropsychological tests, referring the client to a specialist in neuropsychology, while offering to conduct a general psychological assessment within their scope of competence. Option D. Administer the tests and interpret the results, acknowledging in the report that their experience with this specific battery is limited, but that they have done their best to interpret the findings. Correct answer is C. Decline to administer the specific neuropsychological tests, referring the client to a specialist in neuropsychology, while offering to conduct a general psychological assessment within their scope of competence. Explanation. This scenario presents a professional challenge due to the ethical and legal imperative to ensure psychological testing is administered, scored, and interpreted by qualified individuals, adhering to established professional standards and guidelines. The American Board of Professional Psychology (AP) emphasizes competence and ethical practice, which directly translates to the responsible use of psychological assessments. Careful judgment is required to navigate situations where a psychologist's expertise may be tested by the complexity of a case or the limitations of available assessment tools. The correct approach represents best professional practice because it prioritizes the client's well-being and the integrity of the assessment process. This involves a thorough understanding of the test's psychometric properties, its appropriate application, and the psychologist's own scope of competence. Adhering to the ethical principles of the American Psychological Association, APA, which are foundational to AP certification, mandates that psychologists only use tests for which they have been trained and are competent to administer and interpret. Furthermore, it requires them to consider the validity and reliability of the test for the specific population being assessed and to interpret results within a broader clinical context, avoiding over-reliance on single test scores. An incorrect approach that involves administering a test for which the psychologist lacks adequate training or experience represents a significant ethical and regulatory failure. This violates the principle of competence, potentially leading to inaccurate diagnoses, inappropriate treatment recommendations, and harm to the client. Another incorrect approach, such as interpreting test results without considering the client's cultural background, socioeconomic status, or other relevant contextual factors, also constitutes an ethical lapse. This can lead to biased interpretations and misdiagnosis, failing to uphold the principle of fairness and equity in psychological practice. Relying solely on automated scoring or interpretation without professional oversight is another failure, as it bypasses the critical human element of clinical judgment and ethical responsibility inherent in psychological assessment. The professional decision-making process for similar situations should involve a self-assessment of competence, a thorough review of the assessment tool's manual and relevant literature, consultation with colleagues when necessary, and a commitment to ongoing professional development. Psychologists must always prioritize client welfare and adhere to the ethical codes and legal regulations governing their practice. Question 11. Market research demonstrates that psychologists often encounter patients with complex presentations that may not fit neatly into a single diagnostic category, leading to challenges in selecting the most appropriate ICD-10 code for billing and record-keeping purposes. A psychologist has been treating a patient for several months for generalized anxiety disorder, but recently, the patient has begun experiencing significant panic attacks and agoraphobia, impacting their ability to leave their home. The psychologist has documented these new symptoms and is considering how to best represent the patient's current clinical status using ICD-10 codes. Which of the following approaches best aligns with professional and regulatory expectations for accurate diagnostic coding in this scenario? Option A. Select the ICD-10 code that most accurately reflects the patient's current, most significant clinical presentation, including the panic attacks and agoraphobia, even if it means updating the primary diagnosis from the previously documented generalized anxiety disorder. Option B. Continue to use the ICD-10 code for generalized anxiety disorder, as it was the initial diagnosis, and the patient still exhibits some symptoms of generalized anxiety. Option C. Defer assigning any specific ICD-10 code for the panic attacks and agoraphobia until the psychologist is absolutely certain that these symptoms will be a permanent feature of the patient's condition. Option D. Assign a less specific ICD-10 code that broadly covers anxiety-related disorders to avoid the complexity of changing the primary diagnosis and to ensure easier billing. The correct answer is A. Select the ICD-10 code that most accurately reflects the patient's current, most significant clinical presentation, including the panic attacks and agoraphobia, even if it means updating the primary diagnosis from the previously documented generalized anxiety disorder. Explanation. The scenario presents a common challenge in clinical practice, accurately and ethically documenting patient diagnoses for billing and record-keeping purposes, particularly when a patient's presentation is complex or evolving. The professional challenge lies in balancing the need for precise diagnostic coding with the ethical imperative to avoid misrepresentation or oversimplification of a patient's condition, which can have downstream effects on treatment planning, insurance coverage, and patient understanding. Careful judgment is required to ensure that the chosen ICD-10 code accurately reflects the patient's current clinical status and is supported by the available evidence, while also adhering to professional standards and regulatory requirements. The correct approach represents best professional practice because it prioritizes accurate clinical assessment and documentation. By selecting the ICD-10 code that best reflects the patient's current, most significant condition, the psychologist ensures that the diagnostic record is both clinically meaningful and compliant with the principles of ethical record-keeping. This approach aligns with the American Board of Professional Psychology's emphasis on evidence-based practice and professional integrity, which implicitly requires accurate diagnostic representation for appropriate patient care and professional accountability. The use of ICD-10 codes is a regulatory requirement for many healthcare services, and their accurate application is essential for proper reimbursement and continuity of care. An incorrect approach that involves selecting a less severe or a more general diagnosis when a more specific one is clearly indicated fails to meet the standard of accurate clinical representation. This can lead to miscommunication about the patient's condition, potentially impacting treatment efficacy and insurance coverage. Ethically, it can be seen as a form of misrepresentation, even if unintentional, as it does not fully capture the complexity of the patient's presentation. Another incorrect approach, such as assigning a diagnosis solely based on the most easily billable condition without sufficient clinical justification, represents a significant ethical and regulatory failure. This prioritizes financial gain over accurate patient care and diagnostic integrity, violating principles of professional conduct and potentially leading to fraudulent billing practices. A third incorrect approach, which is to avoid assigning any diagnosis due to uncertainty, while seemingly cautious, can also be problematic if it hinders necessary treatment or billing processes without a clear plan for resolution. Professional practice requires making the best possible diagnostic determination based on available information and seeking further clarification or reevaluation as needed, rather than indefinitely deferring diagnosis. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough clinical assessment to understand the patient's presenting problems, history, and current functioning. Second, consult diagnostic criteria, e.g., DSM-5, to formulate a provisional or definitive diagnosis. Third, identify the most appropriate ICD-10 code that accurately reflects this diagnosis, considering specificity and the primary reason for the patient's encounter. Fourth, document the clinical rationale for the chosen diagnosis and code in the patient's record. If diagnostic uncertainty persists, the professional should document this uncertainty, outline a plan for further assessment or consultation, and consider provisional coding if appropriate and ethically justifiable, always prioritizing the patient's well-being and accurate representation of their condition. Question 12. The assessment process reveals that a client, who is being seen for anxiety management, has disclosed a detailed plan to harm a specific former colleague with whom they have a history of conflict. The client has access to the means to carry out this plan, and the threat appears to be credible and imminent. Option A. Discuss the client's disclosure with other professionals in the waiting room to solicit their opinions on how to proceed, ensuring client anonymity as much as possible. Option B. Conduct a thorough risk assessment to determine the imminence and severity of the threat, consult with a supervisor or legal counsel, and if the risk is deemed significant, make a limited disclosure to the appropriate authorities or the potential victim to prevent harm, while documenting all actions. Option C. Maintain strict confidentiality, as the information was disclosed within the therapeutic relationship, and avoid any action that could be perceived as a breach, assuming the client is unlikely to follow through. Option D. Immediately contact the former colleague to warn them of the potential danger without further assessment or consultation to ensure their immediate safety. The correct answer is B. Conduct a thorough risk assessment to determine the imminence and severity of the threat, consult with a supervisor or legal counsel, and if the risk is deemed significant, make a limited disclosure to the appropriate authorities or the potential victim to prevent harm, while documenting all actions. Explanation. Scenario analysis. This scenario presents a common yet complex ethical challenge in professional psychology, specifically concerning the balance between a client's right to privacy and the psychologist's duty to protect potential harm. The psychologist has obtained information during an assessment that, if acted upon without careful consideration, could lead to a breach of confidentiality. The challenge lies in navigating the legal and ethical boundaries of confidentiality, particularly when the information pertains to a third party who is not the client but could be at risk. The psychologist must exercise sound professional judgment to determine the appropriate course of action, considering the specific nuances of the information and the relevant legal and ethical standards. Correct approach analysis. The correct approach involves a thorough, individualized risk assessment. This means carefully evaluating the credibility, imminence, and severity of the potential harm to the third party. It requires consulting with supervisors or legal counsel to ensure adherence to the American Psychological Association's APA, Ethical Principles of Psychologists and Code of Conduct, specifically Principle C, Integrity, and Standard 4, Maintaining Confidentiality. If the risk assessment indicates a clear and present danger, the psychologist must then consider the narrowest possible disclosure necessary to prevent harm, adhering to the principle of duty to warn or duty to protect as mandated by relevant state laws, which vary but generally follow the Tarasoff v. Regents of the University of California precedent in spirit, though specific legal frameworks are jurisdiction-dependent. This approach prioritizes client welfare while fulfilling legal and ethical obligations to protect potential victims. Incorrect approaches analysis. One incorrect approach is to immediately breach confidentiality by reporting the information to the authorities or the potential victim without conducting a thorough risk assessment. This fails to uphold the client's right to confidentiality, which is a cornerstone of the therapeutic relationship and is protected by ethical codes and legal statutes. Such an action could erode trust, potentially harm the client's progress, and may not be legally or ethically justifiable if the threat is not imminent or credible. Another incorrect approach is to do nothing, assuming the information is not serious enough or that the client is unlikely to act on it. This is a failure to exercise due diligence and could have severe consequences if the potential harm materializes. Psychologists have an ethical and legal responsibility to act when there is a foreseeable danger to others, and inaction in such circumstances can lead to ethical violations and legal liability. A third incorrect approach is to discuss the client's specific situation with colleagues or supervisors without a clear, documented need for consultation for the client's benefit or to ensure competent practice, and without taking appropriate steps to protect the client's identity. While consultation is often encouraged, it must be done within the bounds of confidentiality, ensuring that only necessary information is shared and that the client's privacy is protected to the greatest extent possible. Unnecessary disclosure, even for consultation, can be a breach of confidentiality. Professional reasoning. Professionals should employ a structured decision-making process when faced with potential breaches of confidentiality. This process typically involves 1. Identifying the ethical and legal obligations. 2. Gathering all relevant information about the situation. 3. Conducting a thorough risk assessment, considering factors like imminence, severity, and credibility of the threat. 4. Consulting with supervisors, mentors, or legal counsel when unsure. 5. Exploring all possible interventions that minimize harm while maximizing confidentiality. 6. Documenting all steps taken and the rationale behind them. 7. Implementing the chosen course of action in the least intrusive manner possible. Question 13. Cost-benefit analysis shows that a comprehensive psychological assessment battery can be resource-intensive for clients. Considering the principles of ethical practice as espoused by the American Board of Professional Psychology, which approach to assessment is most aligned with professional responsibility when a client presents with a vague concern about general well-being. Option A. Administering a broad range of standardized tests to cover all potential areas of psychological functioning, regardless of specific referral concerns, to ensure no aspect is overlooked. Option B. Recommending a self-administered questionnaire for the client to complete independently with minimal direct professional involvement to reduce costs. Option C. Deferring assessment altogether, suggesting the client seek services from a less specialized professional due to the perceived ambiguity of the presenting problem. Option D. Conducting a targeted assessment that directly addresses the specific, articulated referral question or clinical hypothesis, utilizing only the most relevant and efficient assessment tools. The correct answer is A. Administering a broad range of standardized tests to cover all potential areas of psychological functioning, regardless of specific referral concerns, to ensure no aspect is overlooked. Explanation. This scenario presents a professional challenge due to the inherent tension between the desire to provide comprehensive assessment services and the ethical and regulatory obligation to ensure that such services are both necessary and beneficial to the client. The psychologist must navigate the potential for overassessment, which can lead to unnecessary financial burden for the client, and the risk of underassessment, which could result in misdiagnosis or inadequate treatment planning. The American Board of Professional Psychology, AP, emphasizes ethical practice, which includes principles of beneficence, non-maleficence, and justice, all of which are implicated when considering the scope and necessity of psychological assessments. The correct approach represents best professional practice because it prioritizes the client's well-being and autonomy by ensuring that the assessment is directly linked to a clear clinical question or referral concern. This aligns with AP commitment to evidence-based practice and the ethical imperative to avoid providing services that are not clinically indicated or that could be exploitative. A thorough assessment, when justified, should be tailored to address specific hypotheses or diagnostic questions, thereby maximizing its utility and minimizing extraneous procedures. This approach respects the client's resources and ensures that the assessment process is a focused and purposeful intervention. An incorrect approach that involves conducting a broad battery of tests without a clear, specific referral question or hypothesis fails to adhere to the principle of non-maleficence. This can lead to unnecessary financial and emotional costs for the client, potentially causing harm. It also violates the principle of beneficence by not ensuring that the assessment is the most efficient and effective means to address the client's needs. Furthermore, such an approach may not be justifiable under the ethical guidelines of the app, which advocate for judicious use of assessment tools. Another incorrect approach, that of limiting the assessment to only the most superficial measures to save time and resources, risks under-assessment. This could lead to missed critical information, inaccurate diagnoses, and ultimately, ineffective treatment, thus failing the principle of beneficence and potentially causing harm. Professionals should employ a decision-making process that begins with a thorough understanding of the referral question or presenting problem. This involves active listening, clarifying the goals of the assessment with the client and/or referring party, and considering differential diagnoses. The psychologist should then conceptualize which assessment tools and procedures are most likely to yield the information needed to answer the referral question efficiently and effectively, always keeping the client's best interests and resources in mind. This iterative process of hypothesis generation, test selection, and interpretation, guided by ethical principles and professional standards, ensures that assessment is a valuable and responsible clinical tool. Question 14. Consider a scenario where a psychologist is conducting a therapy session with a client who expresses increasingly concerning thoughts about harming a specific colleague at their workplace. The client details a plan, including the timing and method, and expresses significant anger and resentment towards this colleague. The psychologist has assessed that the client has the means and intent to carry out this plan, and the threat appears imminent. What is the most ethically and legally sound course of action for the psychologist? Option A. Immediately report the client's specific threat and the identity of the intended victim to the appropriate law enforcement agency or the intended victim, while also documenting the decision-making process and the rationale for the disclosure. Option B. Discuss the client's feelings about the colleague in subsequent sessions, hoping that the therapeutic process will de-escalate the situation and delay any external reporting until the client demonstrates overt aggressive behavior. Option C. Advise the client that their statements are concerning and that they should avoid the colleague, but maintain strict confidentiality and do not report the threat to any external parties. Option D. Inform the client that their statements will be reported to the authorities regardless of their intent, and then proceed with reporting without further assessment or consultation. The correct answer is A. Immediately report the client's specific threat and the identity of the intended victim to the appropriate law enforcement agency or the intended victim, while also documenting the decision-making process and the rationale for the disclosure. Explanation. This scenario presents a professional challenge due to the inherent conflict between maintaining client confidentiality and the ethical imperative to report potential harm to others. Psychologists are bound by strict confidentiality rules, but these are not absolute. The American Psychological Association's APA, Ethical Principles of Psychologists and Code of Conduct provides guidance on when disclosure is permissible and, in some cases, mandated. The psychologist must carefully weigh the severity of the threat, the likelihood of it being carried out, and the potential harm to the intended victim against the principles of confidentiality and the client's right to privacy. The correct approach involves a thorough assessment of the client's statements and a determination of whether a clear and imminent danger exists. If such a danger is identified, the psychologist has a legal and ethical obligation to take reasonable steps to protect the intended victim. This typically involves consulting with supervisors or colleagues, documenting the assessment and decision-making process meticulously, and then making a report to the appropriate authorities or the potential victim, as dictated by the specific circumstances and relevant laws. This approach upholds the principle of beneficence and non-maleficence by prioritizing the safety of others while still attempting to minimize the breach of confidentiality. An incorrect approach would be to ignore the client's statements, assuming they are not serious, without a proper risk assessment. This fails to uphold the duty to protect and could lead to harm to a third party, violating ethical principles. Another incorrect approach would be to immediately disclose the information without a careful assessment of the imminence and severity of the threat, or without considering less intrusive measures first. This would be an overreach of confidentiality and could damage the therapeutic relationship unnecessarily. Finally, failing to document the assessment and decision-making process is a significant ethical and professional failing, as it leaves the psychologist without a record of their professional judgment and actions. The professional decision-making process in such situations should involve a systematic evaluation. 1. Identify the ethical and legal obligations, including confidentiality and the duty to warn/protect. 2. Conduct a thorough risk assessment of the client's statements, considering the specificity, intent, and likelihood of harm. 3. Consult with supervisors, colleagues, or legal counsel if unsure about the assessment or appropriate course of action. 4. Document all assessments, consultations, and decisions. 5. Take appropriate action to protect the potential victim, balancing confidentiality with the duty to warn/protect. Question 15. The investigation demonstrates that a psychologist is tasked with assessing a 16-year-old adolescent presenting with symptoms suggestive of anxiety and academic difficulties. The psychologist is considering several assessment strategies. Which approach best aligns with current ethical and professional standards for psychological assessment in the United States? Option A. Relying solely on a widely used but potentially culturally biased online self-report questionnaire for anxiety, as it is quick and cost-effective. Option B. Selecting a general intelligence test and a personality inventory that are not specifically normed for the adolescent population or validated for assessing anxiety symptoms. Option C. Administering a comprehensive battery of tests including a structured clinical interview, a validated self-report measure of anxiety appropriate for adolescents, an achievement test, and a measure of executive functioning, while also gathering collateral information from parents and school counselors. Option D. Utilizing an older, non-standardized projective test that the psychologist has experience with, without considering its psychometric properties or appropriateness for adolescent anxiety. The correct answer is C. Administering a comprehensive battery of tests including a structured clinical interview, a validated self-report measure of anxiety appropriate for adolescents, an achievement test, and a measure of executive functioning, while also gathering collateral information from parents and school counselors. Explanation. This scenario presents a professional challenge due to the need to select appropriate assessment tools that are both psychometrically sound and ethically administered within the specific regulatory framework governing professional psychology in the United States, as overseen by bodies like the American Psychological Association, APA, and state licensing boards. The psychologist must balance the client's presenting concerns with the limitations and strengths of various assessment instruments, ensuring cultural sensitivity and avoiding over-reliance on any single measure. The correct approach represents best professional practice by employing a multi-method, multi-informant assessment strategy. This aligns with ethical guidelines, e.g., APA Ethics Code Standard 9.02, Psychological Assessments, which emphasize the use of assessment tools that are valid and reliable for the intended purpose and population. A comprehensive approach, incorporating interviews, behavioral observations, and a battery of standardized tests tailored to the client's background and presenting issues, provides a more robust and nuanced understanding of the individual. This minimizes the risk of misinterpretation or bias inherent in single-method assessments and allows for triangulation of data, leading to more accurate diagnostic impressions and treatment recommendations. An incorrect approach that relies solely on a single, potentially culturally biased, self-report questionnaire fails to meet ethical standards for assessment. This would violate APA Ethics Code Standard 9.06, Interpretation of Assessment Results, which requires consideration of the limitations of assessment data and the client's characteristics. Such an approach risks oversimplification, misdiagnosis, and inappropriate treatment planning, potentially leading to harm to the client. Another incorrect approach that uses an outdated or unvalidated assessment tool for the specific population or purpose is also ethically problematic. This contravenes APA Ethics Code Standard 9.02, which mandates the use of assessment instruments that are valid and reliable. The use of such tools can lead to inaccurate conclusions and ineffective interventions. A further incorrect approach that fails to consider the client's cultural background and linguistic abilities when selecting assessment tools is a significant ethical lapse. APA Ethics Code Standard 3.0.1, Unfair Discrimination, and Standard 9.0.2, which implicitly requires appropriate norms and validation for the population, are violated. This can lead to biased results and a failure to accurately assess the client's functioning. Professional decision-making process for similar situations should involve a thorough review of the client's referral question, history, and demographic information. This should be followed by a systematic selection of assessment methods and tools that are empirically supported, appropriate for the client's characteristics, and aligned with ethical principles. A commitment to ongoing professional development and consultation with colleagues when faced with complex cases is also crucial. Question 16. Upon reviewing the intake information for a new client presenting with significant anxiety symptoms, a psychologist notes that the client, who recently immigrated from a collectivistic culture, describes their distress primarily in terms of somatic complaints and social disharmony rather than individual psychological distress. The psychologist is considering several diagnostic approaches. Which approach best aligns with the ethical and professional standards for assessment and diagnosis within the American Board of Professional Psychology's purview? Option A. Immediately apply diagnostic criteria for generalized anxiety disorder based on the presence of anxiety symptoms, assuming symptom presentation is universal across cultures and focusing on individual psychological distress. Option B. Focus solely on the somatic complaints, diagnosing a somatoform disorder without further exploration of the anxiety component or cultural influences on symptom expression. Option C. Prioritize a differential diagnosis that considers how cultural norms and values might influence the expression of distress, utilizing assessment tools validated for the client's cultural group, and gathering collateral information to understand the client's social context. Option D. Rely exclusively on a single, widely used anxiety assessment questionnaire, interpreting all scores literally, without considering potential cultural variations in response styles or symptom interpretation. The correct answer is C. Prioritize a differential diagnosis that considers how cultural norms and values might influence the expression of distress, utilizing assessment tools validated for the client's cultural group, and gathering collateral information to understand the client's social context. Explanation. This scenario presents a professional challenge due to the potential for diagnostic bias and the ethical imperative to ensure accurate assessment, particularly when working with individuals from diverse cultural backgrounds. The psychologist must navigate the complexities of differential diagnosis, considering how cultural factors might influence symptom presentation and interpretation, while adhering to the ethical principles of beneficence, non-maleficence, and justice as outlined by the American Psychological Association, APA Ethics Code, which is the primary governing document for the American Board of Professional Psychology exam. The correct approach emphasizes a comprehensive, culturally sensitive assessment process. This involves gathering information from multiple sources, considering the client's cultural context, and employing assessment tools that are validated for the client's population. This aligns with APA Ethical Standard 3.0.4, Avoiding Harm, and 9.0.2, Testing, which mandate that psychologists use assessment tools that are valid and reliable for the intended purpose and population. Furthermore, Standard 3.0.1, Unfair Discrimination, and 3.0.2, Psychological Services, require psychologists to avoid unfair discrimination and to provide services only within their areas of competence, which includes cultural competence. A thorough differential diagnosis process, informed by cultural considerations, is crucial for accurate diagnosis and effective treatment planning, thereby promoting the client's well-being. An incorrect approach would be to rely solely on a single assessment tool or to interpret symptoms through a narrow, culturally bound lens. This could lead to misdiagnosis, potentially resulting in inappropriate or harmful treatment, violating APA Ethical Standard 3.0.4, Avoiding Harm. For instance, attributing culturally normative behaviors or expressions of distress solely to psychopathology without adequate consideration of cultural context would be a failure of cultural competence and could lead to unfair discrimination, APA Ethical Standard 3.0.1. Another incorrect approach would be to prematurely settle on a diagnosis without exploring alternative explanations or gathering sufficient collateral information, which undermines the principle of thoroughness in assessment and could lead to diagnostic errors. Professionals should employ a decision-making framework that prioritizes a systematic and iterative process. This involves 1. Initial hypothesis generation based on presenting concerns. 2. Selection of appropriate assessment methods, considering cultural relevance and psychometric properties. 3. Data collection from multiple sources. 4. Hypothesis testing and refinement through differential diagnosis, actively considering cultural influences. 5. Formulation of a diagnosis and treatment plan that is evidence-based and culturally sensitive. And 6. Ongoing monitoring and reevaluation of the diagnosis and treatment. This framework ensures that the assessment process is robust, ethical, and client-centered, minimizing the risk of bias and promoting optimal outcomes. Question 17. Risk assessment procedures indicate a psychologist is working with a client who expresses a strong desire to incorporate a novel, experimental therapeutic technique into their treatment plan, which the psychologist has not previously utilized and has some reservations about due to potential ethical and efficacy concerns. The psychologist feels personally uncomfortable with the proposed technique, but recognizes the client's expressed autonomy. Which of the following represents the most ethically sound and professionally responsible approach to addressing this situation? Option A. Inform the client that the request cannot be accommodated due to the psychologist's personal ethical reservations and advise them to seek a therapist who is comfortable with the proposed technique. Option B. Immediately decline the client's request, explaining that the technique is outside the psychologist's area of expertise and personal comfort level, and suggest alternative, more conventional treatment options. Option C. Engage in a thorough exploration of the client's rationale for requesting the technique, research its potential benefits and risks, consult with colleagues or supervisors regarding ethical considerations and best practices, and then collaboratively decide on a course of action that prioritizes the client's well-being and autonomy within ethical boundaries. Option D. Agree to implement the experimental technique as requested by the client to honor their autonomy, without conducting further research or consultation, assuming the client is the best judge of their own needs. The correct answer is C. Engage in a thorough exploration of the client's rationale for requesting the technique, research its potential benefits and risks, consult with colleagues or supervisors regarding ethical considerations and best practices, and then collaboratively decide on a course of action that prioritizes the client's well-being and autonomy within ethical boundaries. Explanation. Scenario analysis. This scenario presents a common ethical dilemma where a psychologist's personal values may conflict with a client's expressed wishes, particularly when those wishes involve potential harm or a departure from established therapeutic goals. The challenge lies in balancing the psychologist's professional obligations to beneficence and non-maleficence with the client's autonomy and right to self-determination. Navigating this requires a systematic and ethically grounded decision-making process, rather than an immediate, reactive response. Correct approach analysis. The correct approach involves a structured ethical decision-making model, which is a cornerstone of professional practice as outlined by the American Psychological Association, APA Ethics Code. This model typically includes steps such as identifying the ethical issue, consulting relevant ethical principles and standards, considering potential courses of action and their consequences, and making a decision while documenting the process. Specifically, the APA Ethics Code, e.g., Standards 1, 023, 04 emphasizes the importance of acting in accordance with ethical principles and avoiding harm. A systematic approach ensures that all relevant factors are considered, minimizing bias and promoting a decision that is both ethically sound and professionally defensible. This process respects client autonomy while upholding the psychologist's responsibility to provide competent and ethical care. Incorrect approaches analysis. One incorrect approach would be to immediately refuse the client's request based solely on the psychologist's personal discomfort or judgment about the request's wisdom. This fails to adequately consider the client's autonomy and the potential for a therapeutic benefit that the psychologist may not fully grasp. It bypasses crucial steps of ethical decision-making, such as exploring the client's motivations and potential benefits, and consulting ethical guidelines. This approach risks violating the principle of respect for persons and may lead to premature termination of therapy or a breakdown in the therapeutic alliance. Another incorrect approach would be to agree to the client's request without any further exploration or ethical deliberation, simply to avoid conflict or to please the client. This neglects the psychologist's ethical obligation to avoid harm, non-maleficence, and to promote well-being, beneficence. It fails to engage in a critical assessment of the potential risks and benefits, and it may not align with established ethical standards or the psychologist's scope of competence. This approach can lead to detrimental outcomes for the client and professional misconduct. A third incorrect approach would be to delegate the decision-making entirely to a supervisor without engaging in personal ethical reflection or attempting to resolve the issue independently first. While consultation is vital, an ethical decision-making process requires the psychologist to actively participate in identifying the ethical issues, considering options, and understanding the rationale behind the chosen course of action. Abdicating responsibility undermines professional development and the psychologist's accountability. Professional reasoning. Professionals should utilize a recognized ethical decision-making model, such as the one proposed by the APA. This involves 1. Identifying the ethical problem and the individuals or groups affected. 2. Identifying the relevant ethical principles and standards from the APA Ethics Code. 3. Brainstorming potential courses of action. 4. Evaluating the potential consequences of each course of action. 5. Selecting the most ethically justifiable course of action and implementing it. 6. Reflecting on the decision and its outcomes. This systematic approach ensures that decisions are well-reasoned, ethically sound, and aligned with professional obligations. Question 18. Examination of the data shows a psychologist is initiating dialectical behavior therapy, DBT, with a new client who has a history of complex trauma and emotion dysregulation. The psychologist has previously obtained general informed consent for psychotherapy. Which of the following actions best adheres to regulatory and ethical standards for initiating DBT? Option A. Inform the client that DBT is a standard treatment, and that consent is not as critical as for experimental therapies, focusing primarily on the immediate therapeutic goals. Option B. Proceed with DBT, assuming the client's prior general consent for psychotherapy adequately covers the specialized nature of DBT, and make a brief note in the client's record that DBT is being initiated. Option C. Obtain consent for the general goals of DBT, such as improved emotion regulation, without detailing the specific modalities or the client's active participation requirements in skills training and phone coaching. Option D. Conduct a detailed discussion with the client about the specific components of DBT, including skills training, individual therapy, phone coaching, and therapist consultation team, ensuring the client understands the expectations, time commitment, and potential benefits and risks, and document this comprehensive informed consent process. The correct answer is D. Conduct a detailed discussion with the client about the specific components of DBT, including skills training, individual therapy, phone coaching, and therapist consultation team, ensuring the client understands the expectations, time commitment, and potential benefits and risks, and document this comprehensive informed consent process. Explanation. This scenario presents a common challenge in clinical practice, balancing the ethical imperative to provide effective treatment with the regulatory requirements for documentation and informed consent, particularly when utilizing a complex, multi-component therapy like dialectical behavior therapy, DBT. The professional challenge lies in ensuring that the patient's understanding and consent are comprehensive, covering not only the general goals of therapy, but also the specific modalities and expectations inherent in DBT, such as skills training, phone coaching, and therapist consultation teams. Failure to adequately inform and obtain consent can lead to misunderstandings, patient dissatisfaction, and potential ethical and legal repercussions. The correct approach represents best professional practice because it prioritizes a thorough and ongoing informed consent process that is tailored to the specific demands of DBT. This aligns with the ethical principles of autonomy and beneficence, ensuring the patient is empowered to make an informed decision about their treatment, and that the treatment is delivered in a manner that maximizes its potential benefit. Specifically, it addresses the unique aspects of DBT, such as the commitment required for skills groups and the availability of phone coaching, which are critical for treatment adherence and effectiveness. This comprehensive consent process is implicitly supported by the ethical guidelines governing professional psychology, which mandate that practitioners obtain informed consent for all aspects of treatment, ensuring patients understand the nature of the therapy, its potential risks and benefits, and their rights and responsibilities. While specific regulations for DBT documentation may not exist in isolation, the overarching ethical and legal frameworks for professional practice demand this level of transparency and patient engagement. An incorrect approach that focuses solely on general consent for psychotherapy, without detailing the specific components of DBT, fails to meet the standard of informed consent. This is a regulatory and ethical failure, because it deprives the patient of crucial information necessary to make a truly informed decision about engaging in a specialized and intensive treatment modality. Patients may not understand the time commitment, the structure of skills training, or the role of phone coaching, leading to potential non-adherence or a perception of unmet expectations. Another incorrect approach that neglects to document the informed consent process thoroughly is also a significant ethical and regulatory failure. Proper documentation serves as evidence of the practitioner's adherence to ethical standards and legal requirements, protecting both the patient and the practitioner. Without clear documentation, it becomes difficult to demonstrate that informed consent was, in fact, obtained, potentially leading to disciplinary action or legal challenges. A third incorrect approach that assumes patient understanding based on prior therapy experiences fails to acknowledge the unique nature of DBT and the importance of reestablishing consent for each new therapeutic modality or significant change in treatment. This is an ethical lapse as it presumes knowledge rather than actively ensuring comprehension. The professional decision-making process for similar situations should involve a systematic approach to informed consent. This begins with a clear understanding of the specific therapeutic modality being offered, in this case, DBT, and its core components. The practitioner must then translate this understanding into clear, accessible language for the patient, detailing the purpose, procedures, potential benefits, risks, and alternatives. The process should be interactive, allowing for patient questions and concerns to be addressed. Crucially, this consent process must be documented thoroughly, including the date, the information provided, and the patient's assent. For ongoing therapies like DBT, the informed consent process should be revisited periodically, especially if treatment plans or modalities change, to ensure continued patient understanding and agreement. Question 19. Performance analysis shows that a client undergoing cognitive behavioral therapy for social anxiety reports significant subjective improvement in their confidence during social interactions. However, objective behavioral observations during a structured role-play exercise reveal only marginal changes in their nonverbal communication and a continued tendency to avoid eye contact. The psychologist needs to conduct an impact assessment to determine the effectiveness of the therapy. Which of the following approaches would best represent best professional practice in this situation, adhering to the ethical guidelines of the American Board of Professional Psychology? Option A. Integrate the client's self-report with objective behavioral observations from the role-play, and seek consent to gather collateral information from the client's spouse to provide a more comprehensive picture of social functioning changes. Option B. Conduct additional, more complex psychometric testing to identify underlying cognitive deficits that might explain the discrepancy between self-report and observed behavior. Option C. Rely primarily on the client's self-report of improvement, as their subjective experience is the most important indicator of therapeutic success. Option D. Focus exclusively on the objective behavioral observations from the role-play, as these provide the most scientifically valid measure of change. The correct answer is A. Integrate the client's self-report with objective behavioral observations from the role-play, and seek consent to gather collateral information from the client's spouse to provide a more comprehensive picture of social functioning changes. Explanation. This scenario presents a professional challenge because the psychologist must balance the need for objective behavioral assessment with the potential for bias introduced by the client's subjective reporting and the clinician's own interpretive framework. The client's self-perception of improvement, while positive, may not align with observable behavioral changes, necessitating a multi-method approach to validate progress. Careful judgment is required to ensure the assessment is comprehensive, accurate, and ethically sound. Adhering to the American Psychological Association's ethical principles of psychologists and code of conduct, particularly regarding assessment, record keeping, and avoiding harm. Correct approach represents best professional practice because it integrates multiple sources of data, including objective measures and collateral information, to provide a robust and triangulated understanding of the client's progress. This aligns with ethical guidelines emphasizing the use of appropriate assessment tools and methods and the importance of basing conclusions on sufficient evidence. Specifically, the APA Ethics Code E.G. Standard 9.01 Basis for Assessments, Standard 9.02 Use of Assessments, Standard 9.06 Interpreting Assessment Results mandates that psychologists use assessment tools and methods that are valid and reliable for the intended purpose and that interpretations are based on sufficient data. Incorporating collateral information from a spouse or partner with appropriate consent offers an independent perspective that can corroborate or challenge the client's self-report, leading to a more accurate impact assessment. An incorrect approach that relies solely on the client's self-report fails to acknowledge the potential for self-serving bias or inaccurate perception of change. This could lead to an overestimation of progress, potentially resulting in premature termination of therapy or inappropriate recommendations, which could be detrimental to the client's well-being and violates the principle of beneficence and non-maleficence. Ethically, this approach may also fall short of the requirement to base conclusions on sufficient evidence. Another incorrect approach that focuses exclusively on a single, potentially narrow, objective measure without considering the client's subjective experience or other relevant behavioral domains risks providing an incomplete picture. For instance, focusing solely on a standardized questionnaire might miss crucial qualitative changes in interpersonal functioning or emotional regulation that are important to the client's overall recovery. This could violate the principle of providing services that are tailored to the client's needs and may not fully capture the impact of the intervention. A third incorrect approach that prioritizes anecdotal observations without systematic documentation or objective validation lacks the rigor required for a professional impact assessment. While observations are valuable, without a structured framework for recording and analyzing them, they are susceptible to subjective interpretation and memory biases. This can lead to unsubstantiated conclusions and a failure to meet the ethical standard for maintaining accurate and adequate records, Standard 6.01 Documentation of professional and scientific work and conduct. Professional decision-making process for similar situations should involve a systematic evaluation of the client's goals, the nature of the intervention, and the most appropriate methods for assessing change. This includes considering the client's self-report as one data point among others, actively seeking collateral information with consent, utilizing a range of objective and subjective assessment tools, and engaging in ongoing, collaborative evaluation of progress. The psychologist must critically appraise all data, consider potential biases, and ensure that the assessment directly informs clinical decision-making in a manner that prioritizes the client's welfare and adheres to ethical standards. Question 20. The risk matrix shows a client diagnosed with a DSM-5 disorder. Which approach to managing potential risks associated with this diagnosis is most aligned with best professional practice in psychology? Option A. Rely primarily on the severity of reported symptoms from the DSM-5 to determine the level of risk, without considering contextual factors or individual coping mechanisms. Option B. Assign a generalized risk level based solely on the diagnostic category within the DSM-5, without further individual assessment. Option C. Focus intervention efforts exclusively on symptom reduction as indicated by the DSM-5 criteria, assuming this will inherently mitigate all potential risks. Option D. Conduct a comprehensive risk assessment that integrates the DSM-5 diagnosis with an evaluation of individual risk factors, protective factors, and the likelihood and severity of potential harm to inform intervention planning. The correct answer is D. Conduct a comprehensive risk assessment that integrates the DSM-5 diagnosis with an evaluation of individual risk factors, protective factors, and the likelihood and severity of potential harm to inform intervention planning. Explanation. This scenario presents a professional challenge because the psychologist must integrate information from a DSM-5 diagnosis with a risk assessment framework, necessitating a nuanced understanding of both diagnostic criteria and potential behavioral outcomes. The complexity arises from the fact that a DSM-5 diagnosis, while informative, does not automatically dictate a specific level of risk. The psychologist must move beyond simple diagnostic labeling to a dynamic assessment of individual factors contributing to potential harm. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized risk assessment that directly informs intervention strategies. This aligns with ethical guidelines for professional psychology, which mandate that psychologists conduct assessments that are relevant to the purpose of the evaluation and that their conclusions are based on sufficient information. Specifically, the American Board of Professional Psychology, APP, emphasizes the importance of evidence-based practice and the application of psychological principles to real-world problems, including safety and well-being. A thorough risk assessment, considering the interplay of diagnostic features, personal history, environmental factors, and protective elements, allows for the development of targeted and effective interventions, thereby fulfilling the psychologist's ethical obligation to promote client welfare and minimize harm. This approach is grounded in the principle of beneficence and non-maleficence. An incorrect approach that relies solely on the DSM-5 diagnosis without further risk stratification fails to meet professional standards. This is because a diagnosis is a classification of symptoms, not a direct predictor of future behavior or risk. Such an approach could lead to overpathologizing or underestimating risk, potentially resulting in inappropriate or insufficient interventions. Ethically, this would be a failure to conduct a thorough and individualized assessment, potentially violating the principle of competence and the duty to protect. Another incorrect approach that focuses exclusively on the severity of reported symptoms, without considering the context or the individual's capacity to manage those symptoms, also falls short. While symptom severity is a component of risk, it is not the sole determinant. This approach neglects the crucial element of protective factors and the individual's coping mechanisms, leading to an incomplete risk profile. This would represent a failure to gather sufficient information and conduct a comprehensive evaluation, as required by ethical codes. A third incorrect approach that prioritizes a generalized risk category based on broad diagnostic groups without considering individual nuances is also professionally unacceptable. This approach risks stereotyping and overlooks the unique presentation of each individual. Ethical practice demands an individualized assessment, recognizing that individuals with the same diagnosis can present with vastly different risk profiles. This would be a failure to adhere to the principle of justice and fairness in assessment. The professional decision-making process for similar situations should involve a systematic approach. First, accurately diagnose using the DSM-5. Second, identify potential risk factors associated with the diagnosis and the individual's presentation. Third, identify protective factors that mitigate risk. Fourth, assess the likelihood and severity of potential harm. And fifth, develop an intervention plan that directly addresses identified risks and leverages protective factors, all while maintaining ongoing monitoring and reevaluation. This iterative process ensures that the assessment remains dynamic and responsive to the individual's evolving needs and circumstances.